Yeah, hi everybody. So thank you for coming and joining, and thank you everybody for your patience. We actually had some technical problems earlier, as you could see, but I'm grateful that like you guys had the time to wait for a little bit, and then we're actually going to talk about the master program this year in 2026. And we were talking about the aesthetic medicine, how it's like, how is the course like, what the course is going to include. And of course, by the end of the presentation, if you have any questions, feel free to shoot it. Yeah. So we'll be talking about the discovery of the international master degrees in aesthetic medicine, nutrition, and anti-aging. Next page, please. Yeah. So the program itself, it will be it will be starting from the April 2026, and of course, it's a hybrid mode. Meaning that it's actually a combination of a theoretical part and the combination of the practice, and of course the hands-on are probably most of the important parts where most of you are waiting for. And when it comes to the credits and the hours, then it will be a little bit less than 100 hours of practical lessons, and with the possibility of rewatching it, with the possibilities of like asking questions on the platform. And you shouldn't worry about that, because with my experiences, when I was actually enrolled in these courses, whatever questions that we ask it and post it on the platform, it was always being answered, and then they were always happy to give you like recommendations or advices on whatever questions you have. And the doctors are, of course, just like every single physician, they have their own style. So when they have their own style, they have their own preferences. For example, the size of the needles, uh, the way of injections, and you will be able to see like all different kinds of like style, all different kinds of ways or methods or preferences of injection, or like the recommendation ways, or what to avoid, what not to avoid, what prefer to do before the treatment, for example. And I think that is what is the most precious thing about this course as well. And besides that, by the end of the course, you will be able to get two to three. You will be able to get two license, well, not license, certificate. That will be the one certificate from the Medical University of Łódź, and the other one will be coming from the UDIMA, the postgraduate studies. So just remember that like you finish one course, but then you will be able to get two certificates. Next page, please. Thank you. When it comes to the program, so when it comes to a program, of course, as I mentioned earlier, there is methodology, meaning that first of all, there are all video classes, like hours and hours of video classes, and then they were explaining everything in detail, like all the informations you needed. And even they will combine it with like some anatomical part of injections. Of course, what like I said, what muscles you need to be focused on, especially when it comes to Botox, right, and the fillers. So that's included in there. And of course, that there is this download. You can download their study materials, the PDF. I find the PDF actually really interesting because like there are sometimes, to be honest, there are some people that prefers to watch the video, and then there are some people that actually prefers to read like a book. And they have it both. So I actually find that I find it very practical. And when it comes to the theoretical practical modules, they actually separate it into 8 different topics. And I think the way they actually separate them were actually very, I would say that it's in a very organized way. And I actually like it as well. And we will talk about the hands-on clinical practice in the next couple of slides, of course. And what about the master includes? The master actually includes quite some topics. And of course that first of all, of course when you'll be practicing, you will definitely need the civil liability insurance. And when it comes to you practicing in Madrid, then sorry, in actually in Madrid, then you will be able to have the all the notes actually, because when you are on this hands-on practice, then every single let's say that physicians, they have their own presentations. Then by the end of the class, by the end of the day, you will always be able to ask for the extra presentation, like the extra PPT from the each physicians. And well, when it comes to the expert master classes, by the end of the session, like the end of the well, of course, in my year, when by the end of the whole courses, then there is this expert classes, and it was like the whole phase, extra master classes they call it. And they will have the essence of the combo of a couple different um couple different treatments, and then they will tell you, how to what is the best way to assess the facial structure of these patients, and what would be the best for them, for that patient particular. For example, it's like the tailored, of course, like they teach you how to do the tailored treatment basically for that patient. And later on, even after you graduated, then you will be able to have this communication and the connection between the physicians. And it's of course an international environment. This is what I like very much, because then you will be able, because look, like different countries and different physicians, as I mentioned earlier, they have different parent preferences, and you can always exchange your informations between each other. For example, there is a Polish physician, and then there are Spanish physicians, for example, and there are other, physicians from different countries as well, and then they all have like their different preferences and um, different adjustment, or they have their different definition of their treatments, or how they prefer to do things. So I think exchanging knowledge is one of the the really good things in this course as well. And of course, I mentioned earlier, there's these dual certifications. So you get to have dual, like two different certificates, one from the Amir and Udima, and then the other one is, of course, from the Uchi University as well. And well, of course, there's this, like extra, let's say, after class. So after class, you would have this, Madrid experience tour. And of course, you will have locals teach you and tell you, like actually give you advices on where to go, what to do. And it's a beautiful Madrid. It's a beautiful city. So of course, that's a very nice thing to do as well after class. And of course, the catering is included, so you don't have to worry, between classes, because the class is usually long, and it actually goes through the whole day. So it's actually really nice if you could actually have some snack, or like with you, of course. But then usually the lunch it's included, so you don't have to worry about where to go for lunch. Next, please. Thank you. So examples of the hands-on practices. Um, So this year, what we will be doing is, you will have one physician actually. You will have one physician with the group, and then you will go through the whole day with this physician. Uh, I think that like it would be really nice if before the practice, before the hands-on, you can prepare your questions, or like you could actually have you could actually have some questions prepared for a physician, or like if you actually are afraid of something, like have some worries about certain patients, you can always discuss it with them. And I find this hands-on practices very, very helpful for me back then, because you get to see all different types of patients, and all different patients, they have like different requirements, they have different needs, they have different expectations, right? And besides that, because it's through different physicians. So, their access through those, solutions towards the expectations that the patients have are could be different. So you get to see how they do the problem solving, how they actually do the problem solving, and besides that, you get to actually understand that, oh, different ages, different groups, or even different types of skin has a different approach, and we're not even talking about just different treatments. So back then I find it actually really nice. Next, please. So there's the program, the aesthetic medicine, right? So this program. So first of all, it's a hybrid model, and it starts actually in April 2026, and the course starts lasts for about 8 months, and you come for the practice, you come for the hands-on practice as well, and then later on, you get the certifications, and then of course the credits, as you get for some physicians that's important for them, that's 60 ECTs. Yeah, next page, please. Thank you. So how are the hands-on practices? The hands-on practices, basically, it's as I mentioned earlier, you got to get yourself prepared for that. It's actually 7 full day, well, 6 days, six full days and a half, or 7 full days, basically. And it will be basically preparing you will be practicing in the clinic with different patients, with a lot of patients, of course, and every single day there are a lot of informations for you to learn. There are a lot of informations that you will have to take notes on, or even bring your laptop, just to get prepared for that. And yeah, and then you will have a lot of discussions that you will be having, or like exchange your connections between the physicians as well during that day. And you'll be supervised. It'll be a supervised practice with the patients together, and then the basically the physician that's supposed to be the doctor, basically the lecturer that's responsible for you, will be there, and then they will supervising you at the moment, and they will teach you how to do it. Sometimes they will show you how to do it, and if necessary. And of course, that like I actually in my year, I actually had this experience where it was really nice that there were like physicians, they have experiences in different levels, and then they were communicating and actually exchanging their opinions, and then their ways of approaching the patients between each other. So it's always extra information, and it's always nice to learn from that. And then when it comes to the practitioners, you will be able to learn directly from the expert faculty. Yeah, so as my colleague, and we will be there, and me back then as a student, that I think that I'm grateful for the fact that I could actually still keep the contact with them, because it's always wonderful to learn from each other. And, aesthetic medicine is like a never-ending journey, as everybody knows. So I think this is a really good advantage in this course. And when it comes to culture and social activities, as I mentioned earlier, you will let's be honest, you will finish a little bit late, but then you will learn definitely a lot. And you finish a little bit later, then you will be like planning your time for dinner, and then you can have time to hang out with your colleagues, and then like visit this beautiful city. So I think it's a win-win for everybody. So when does it start? So this hands-on will be either in October or in November. So before that, practice, prepare yourself for a theoretical part, and later on, then we get more hands-on with the patients. Yeah. Okay. Next page, please. Thank you. Oh, there's a video as well. Yeah. So as you can see, pay like we have all those physicians from all different countries, and then they all have their different backgrounds. Some of them are on the way of specialization, some of way are the fellows, some of them are already specialized. And for example, we actually had this plastic surgeon as well, who were our colleagues as well. And then some of them already had their own clinics. They're all different types of physicians from different countries and with different levels of experiences, which is really nice in my opinion. Thank you. So hands-on training, as I mentioned earlier, that it's usually a small group and a small group people, and every single person gets to practice with the patients. So you don't have to worry that, oh, if the group will be too big, you don't have to worry that, oh, if I won't be able to have the chance to practice, to have the hands-on. Don't worry about that, because every single person will get their chances to, like to learn how to do it, to how to basically practice on the patient, to basically get used to, the needles, or get used to the method, or the technique. So, don't worry about it. The hands-on is a very unique experience, and I believe that it's totally worth it. Yeah. So that is the clinic. And first, you will have to sign this paper, and in order to start all the procedures, and later on, you will have your schedule. You'll be written, with whom you will be having classes and which room you will be having classes, as you can see here. And then now you will be practicing with the physicians as well. And then we actually have the organization group as well. And then, just in case you need coffee, they have coffee machine as well. And those are the treatment rooms. Then you will usually have patients there, and then the physicians, and then there will be a couple, like colleagues of yours that will be joining you, having a little group, and then you will just have the classes all together through the 6 7 days. Yeah. Okay. Why do okay? I'm going to, perform, like, I'm going to present you according to the slides, where it's like why to choose this program, right? There's flexible format, and then there's a global and EU valid certifications, and then there's access to cut edge acid techniques. But what I'm going to tell you right now is from my own personal experience. Why did I choose this program? So the reason why I chose this program was simply that back then I did, to be honest, I did some research with, and I compared it with a couple of different aesthetic master programs with different countries. And then I realized that this program actually it has actually a lot of like theoretical part, and then actually it's quite some hours. Of course, you will need to focus, and you will have to learn something. You have to, basically, keep your time. You have to have time to learn it. But I think it's totally worth it, because they actually don't mess around with their informations. So you will get a lot of like quite some hours of information. That's first of all. And then secondly, that from my perspective, I think that as I keep emphasizing this point, where the hands-on are important, but and asset medicine, I think that perhaps some of you already have quite some experiences as well. But then what I'm trying to say is that in asset medicine, like hands-on practices are the most important thing, because anatomy, okay, great, and then what you're supposed to do. But then when it's like surgery, but in real life, like in a real situation, like you have to first, learn what is the golden method of doing things. And then secondly, that, every single patient, every single different, like they have their own different skin types, skin quality. They have their own, they might actually come from different countries. They might have different skin tone. Okay. And then next, they might have different structures, and their forehead might look different, or their lips might look different. You cannot have one method for, like two different types of lips. It's not possible. So, what I really like about this program is especially the hands-on. You really need to join this hands-on, because, different patients, they give you different experiences, especially when it comes to different physicians. They give you a different method of such, so like they give you a different solution, basically. So This is what I really like. And besides that, I think that everybody is very friendly to help. And like you will not you will not have those, some of the physicians that's like just coming to teach you and not giving you like time for extra questions. But no, they were always willing to, give you extra informations. They were always willing to answer whatever questions you have. And I think what is the most important is that they always comes and teach you with with their enthusiasm. I think this is, what is very important, what is making you want to learn, encouraging you to do and then to, start your career as a esthetician, because, it's very encouraging. So me personally, I find this master program really, it's really worth enrolling. That's what I'm saying. I think that, like it totally gives you a different perspectives, no matter which level of experiences that you're having, or you're just starting your esthetician career. I believe that it's the right place for you. Yeah. So do we next page, please? Thank you. Okay, so that's it. So if you have any questions, please feel free to shoot in.